Now that it's been determined that reporting total case numbers for COVID is no longer accurate because of the limited testing capacity, health officials will now have to look at other data to try and figure out how Omicron has taken control. There are other ways, but how accurate they are has to be determined.
You're never looking for one thing. You're always looking for multiple things. And a piece of that is because you know that indicators will come and go.
It was never just tests and positive cases that health experts and officials have been looking at during the pandemic. The science involves much more. For example, the amount of people in hospital and ICU has risen again and have now become a focal point, but those numbers don't offer a full picture.
You don't want to use it by itself because one of the challenges with hospitalizations, of course, is that they're delayed after cases. And so that adds, cases are already delayed after transmission events, right? So you get this cascade that goes down and hospitalizations are later.
While testing is limited, positivity rates can give specialists a general sense of just how severe the overall case rate within the general population may be. Those numbers have skyrocketed across the country and the world, and yet there are some problems with using that data as well.
So the issue with positivity is it depends on who's actually getting tested. And so when you restrict it, who's able to get a test, then you may change, who's likely to test positive.
Testing wastewater is another method that's been used by labs throughout Canada to determine the general presence of the virus in communities, but without offering specifics on who has it and individual impact.
Absolutely, wastewater correlates well with case numbers, and moreover, it's a leading indicator of whether or not there's going to be hospitalizations. And that lag period is roughly, on average, at least in the Ottawa experience and actually the Hamilton experience as well, is roughly 10 days before hospitalizations.
Experts suggest a closer look at absenteeism at work may now also be something to analyze, with more and more people needing to take time off sick. There's no telling at this point where the light is at the end of the tunnel. Indications are, though, officials will be looking at all the numbers to determine where we're at.
It's hard to say what the next move is going to be. I think we know that the vaccines are not working so well against Omicron. So once you start, people start mixing again, you're going to have more infections again.
Mark McAllister, City News.